It is 11:05, just in time to get started with the Dr. Payne Show. The phone line's ready to go here. 416-870-6400, star 640 on cell. We'll get to your calls here in a few minutes. Pinpoint Health. That's what you're doing.
Health, yeah.
It's ramping up, pal. I've seen the signs on the building.
It's changing. But after Labor Day, this is the Pinpoint Health Show. It all changes. Yeah. Creating one brand, a consistent brand, so that people know where they're going. They can feel safe about where they're going. The clinics that we're acquiring, just incredible people that we're adding to the team, which is very, very exciting because we already had an incredible team, and we just keep adding more and more people that just have so much experience, so much compassion to want to help people and do it the right way. And so I'm very, very excited about what's happening. And I'm just really, I think it's great for people to know where they can go. And I mean, I say it on the show live. I say it when I see a person. I would never force anybody to just come to one of my locations. You can go wherever you want for your care. Just make sure you're going for the right care. That's all. Mm-hmm. Just, I had a gentleman this week, and knee pain, long-standing, 20-year history. Nothing really mechanically wrong in terms of ACL, PCL, MCL, LCL, meniscus, like from a true ligament meniscus perspective, which are the bad things, which I may actually have a meniscal tear right now. Everything was fine. And it was very much a functional issue, like a patellofemoral, where it's a tracking issue with the patella because one side is weak, one side is not strong enough. And 20-year history, and I sort of went through, okay, well, what have you done? Oh, I've gone for physio. Okay, well, how many sessions of physio have you done? 5 or 6. Okay, and what were they doing? They were focusing really on rehabilitation, all the right care, right? And I basically stopped them and I said, we can stop right now. You just have to go back to where you were going because they were giving you the right care. You need to continue with it. Yeah. Like five sessions is not enough. Like when you're dealing with a 20-year history of something.
That's nothing.
Yeah. And I basically said, like, why did you stop? Oh, I just didn't think it was doing anything. Well, you're not even giving it a fair shot. You have to give these things a fair shot. Now, it may be the fault of the practitioner. Like this is where when you're reporting your findings to a patient, it's very important to go through all of these things, the expectations for care, what you're looking at. I always make sure to tell people, like if I'm recommending them to do 3 weeks of care, for example, what the realistic expectations are after 3 weeks. And a lot of the times when you're dealing with certain injuries, after 3 weeks, all you're looking to do is see that the person's not getting worse. Right? And are things maybe slightly better, 5-10%. But if you can have that discussion and you can make someone understand that from the beginning, then they don't get to that point and feel like it's not doing anything. Right? And so I think it's really important. And actually, I had another person that had a severe disc issue in their low back. Same thing, had done 5 or 6 sessions. This happened in April. Wasn't really getting better, or at least, and this was funny because he thought he wasn't getting better. And he explained that when this first happened, he could barely stand straight. He had extreme pain going down his leg. And when I saw him in my office, his straight leg raise, which is a way of checking for nerve tension, was absolutely normal. His posture was perfectly straight. I said, well, I mean, I didn't see you on day one, but based on what you're describing of yourself in April and the way I see you today, you're definitely better. He's like, well, I am better. I was like, but you just said you weren't any better, right? Like people often don't realize these things. And same thing. And I was like, well, how much therapy have you done for this? Oh, about 5 or 6 sessions, same thing. And I was like, but why? Oh, same thing. I didn't feel like it was doing much. Well, clearly it did something. You're not bent over in an antalgic posturing. You don't have excruciating nerve pain going down your legs. So it was working.
Keep it up, son.
Yeah, you got to keep it up. And so same thing. When I hear that people are going to places, the care is right, I just encourage them to keep going there. I'm not there to try to take patients from anyone. Our goal is really to make sure that people get the care that they need. I always make sure to make people understand what you're looking for in a clinic, right? If you're going to go somewhere, make sure, look for red flags. If it feels iffy to you, you should stop. But if you're looking for a place where you can feel safe, that has accountability, Pinpoint Health is your place for sure.
We'll take a short break, first one, and get the phone lines. They are open now for you. You have pain concerns, health concerns about yourself, or possibly calling for someone else, do so, no problem. 416-870-6400, star 640 on cell. Dr. Payne Show, Global News Radio. 11:12, Dr. Payne Show, 416-870-6400, star 640 on cell. I heard something about you and a knee problem?
Oh,
you?
man.
Oh, come on.
I've had knee problems throughout my life. I used to be incredibly active when I was younger, running a lot, probably like 7-8 kilometers a day. And I've had a lot of patellofemoral issues, which are the tracking problem, which is this low-level ache when you're doing things. But a few weeks ago, I've been myself getting back into shape. I have a trainer that actually trains our patients in home care. He's amazing, Sam. And he's actually been training me, getting me back into to doing everything. And so I've been running, I've been training, and we were doing a reverse lunge. And as I did it, I felt something right away in my knee, like very specific and sharp. And it's funny because these are all the questions that I ask when I'm going through a problem, but it's not until you experience it that you're like, wow, I truly understand. Yeah. And I'm fairly confident, and I've even had the knee surgeons that I work with look at it, and they are fairly confident I'm going to go for an MRI when I get back from my vacation just to confirm, but it's likely a meniscus tear.
Okay.
And I could tell you something now about experiencing meniscus tears. If you're just normal, you're not doing much, it actually doesn't bother you. Like, I'm not sitting here right now and in pain.
Okay.
But there's these finite little movements that will happen where the excruciating
Just
pain.
make a yelp.
Oh my God. Like, it's crazy. Like, and it really has to do with full extension. Like, I was actually able to run several times, no problem whatsoever. Like, when I say that I'm running, like a light, pathetic jog, right? Like, I'm not a marathon runner, but
it's like Sebastian Maniscalco says, it's like the valet run, going to get your car.
Yeah, so that's what I could do that, no problem. But last Sunday, my wife and I and our baby, like in the stroller, we went for a walk, and where we live, there's a lot of hills.
I know.
And by the time I got back, I literally, the last maybe half a kilometer, I had to stop every 3 steps because it was, my knee swelled. Wow. It was crazy. And I realized, because then I start like breaking this stuff down in my head, thinking like, well, why is running fine? And why is that worse? And it actually has to do because most meniscus tears happen towards the front of the knee, right? Which, again, the meniscus is the piece of cartilage within the knee. Okay. So when you're actually doing that pathetic light jog, you're actually mostly in flexion, right? Think about a light jog. You're actually never really truly extending fully. So you don't actually aggravate that front of the knee, and if that's where the tear is. But with a walk, especially uphill and downhill, you actually have to fully extend. And every time you're fully extending, with that extension, you're putting pressure on that
That's when
tear.
It hits you.
And wow, even now, certain movements that I'm doing, like if you're going up from the ground and you're going up straight to get into full straight stance, man, crazy. And so I have a new appreciation. Like, I mean, I've identified thousands of meniscus tears in patients, but I have a new appreciation for what everyone's gone through with these, because it's crazy, the excruciating pain that it can cause.
So we're not hitting the gym and doing leg extensions after this?
Not leg extensions, but actually, funny enough, I've still been able to do the functional stuff that I've been doing. I just really, it's more the low level stuff, like the walking, like I'm saying, with that, it's just killing me. But when I'm actually active in doing stuff, because I can control how much extension I'm putting into it, I'm actually, that's the problem. It seems to be walking is the worst thing, and stairs.
416-870-6400, star 640 on cell is the number. Get some questions happening. Ross, thanks for hanging on. Good morning.
I spoke with Dr. Lou a couple of weeks ago. My wife's having a knee replacement.
Yep.
A week from Monday, we talked about bike riding. My simple question would be, is the length of the time more important than increasing the pressure on the wheel?
Yeah, so cycling, when we talk about cycling, I don't often recommend like outside cycling for knee issues. No. It would be a stationary cycle.
That's what it is.
And yes, it's more about this is not a spinning class. It's not about the resistance. It should be a light pace with very little resistance, and it's more about the time. If you can increase the time, that is better.
Good enough. Even after the operation, same story?
Yeah, and remember, after the operation, you're going to have to sort of go back to square one, right? Like start again, reduce the amount of time. I don't know what the time was, but let's say it was half an hour you've gotten up to. Don't start with half an hour after the surgery. Go back to sort of the beginning and maybe start with 10 minutes, see how that feels. Do that for a few days. Feels okay, move it up to 15 minutes. Do that for a few days. It's very important that the grading component of the rehabilitation.
Good answer. Thank you, sir.
No problem.
Okay.
Good luck.
Yep. Bye-bye.
Thanks for being on top of it, Ross. See, that's what it takes. Just grade it, right?
And that's it. Just simple advice. Now, I do recommend that there should be a physio component that happens, right? Like you need to build strength in those things, but cycling is definitely part of the overall rehabilitation program.
Is that because it takes certain pressures off the body, cycling, or a set of pedals by the chair?
100%. Really, if you have knee issues, cycling should be your friend. Like, even when I saw Rob Gordon, Dr. Gordon, who's been on the show several times about my knee, he basically told me, he's like, just only cycle, don't run. And it's like, same thing. You're like, like you don't like hearing it, but it is what it is. And if you do the right things, you'll manage it well. And if you do some dumb things like I've done in the last few days, you're going to aggravate it.
Yeah, you're going to yelp. Madonna, hello there. Good morning.
Oh, hi.
Hi. What's going on with you?
I'm good. So I have a question about, I guess it's my knee. The pain is around the knee anyway, but it doesn't feel like it's right on like in the kneecap, if you want to say.
Sure. Okay.
But anyway, it happens like if I'm on the treadmill and I'm running for about half an hour to 40 minutes, and then it happens every time. I have to stop. The pain gets excruciating, and I have to go sit.
Okay.
Doesn't happen with the other leg at all.
And what have you done about this so far?
What have I done about it?
Yep.
Well, I'm not going to a regular doctor because no, I haven't done anything. I go and sit after.
I want you to finish that sentence. Why are you not going to a regular doctor? Because why? I'm curious.
Oh, they might just give you some pain meds.
Okay, that's a fair answer. But have you seen, like, you can go to a physiotherapist, a chiropractor? Have you seen anybody about it?
You know what? It just requires X-rays and more appointments. I just wanted to see if you could give me just a snapshot of what it could be.
So I think that's the wrong approach for sure. I think when you have these things, like, I mean, it's a repetitive injury that keeps happening every time you're running. And so if you don't get it looked at, then you can expect that will continue to happen. And if you keep aggravating it, it will likely get worse and could potentially develop into something more serious, right, in terms of tears and things like that. Now, I don't know. There may already be a tear in there. But this idea of being afraid and really the first component of healthcare is getting a diagnosis, right? And so everyone often assumes that it's immediate treatment. It's like when I say go see somebody, it's not so much about like the treatment right away, but what is the diagnosis? And the diagnosis will tell you what the potential intervention is. So for example, with what I got going on with my knee, I don't want to have surgery, but if I have a tear in there that's going to cause me to lock up and not have to do things, I'm going to go for surgery. You know, that's just the reality of it. And what's more important is I'm not jumping to the idea of surgery. What's more important to me is the confirmation that it is either a meniscus or not a meniscus. If it's not a meniscus issue and it's something more functional, then I'll deal with that from a rehab perspective. But the diagnosis is an important component. And when I say go see somebody, at the very least, go get the diagnosis.
So an X-ray on the...
Not necessarily, no. So imaging is not... A diagnosis is something that a professional comes to using all tools, the history that they take with you, the physical exam, and any additional tests if required. Imaging does not give you a diagnosis. It gives you a clinical impression, but it has to be correlated with what's going on with the patient. So you have to see somebody, number one, who understands the knee. They need to go through a history with you. Then they need to do a good physical exam. When we've had Dr. Gavin and Dr. Gordon, who are both knee surgeons, they've often said that the best thing is a good physical exam of the knee, and oftentimes the imaging is just really to confirm what's going on.
Oh, so what doctor would I get a referral from first?
You can come see me if you like, and I'll get you that diagnosis.
Well, I'm in the Barrie area, and I don't drive, so if I were to just stay around here, like, who would I see, a chiropractor?
Again, it's very hard for me to make a general recommendation because I can't recommend anyone specific up there that I can think of. It's really about, doing your own research and seeing who you think you can find to have a look at it.
So you can't say what it could be?
No, I have no idea. I have no idea.
Really? So have you heard of it, though?
Have I heard of knee pain? Yes.
Well, it's not like a knee pain. Like, I have no knee pain right now. It's only if I get on the treadmill for like 40 minutes, and then I just got to go.
But again, that's, that is a drop of water in the history. Like, you're asking me to give you a diagnosis on one simple thing. I have to assess the knee in order to give a diagnosis.
Madonna, appreciate the call. Plenty of time for you as well. You have issues just like that. Bring them on. Get the conversation started. 416-870-6400 *640 on Sal Dr. Payne Show, Global News Radio. It is 11:23. Dr. Payne Show, 416-870-6400, star 640 on your cell. Want to reach out? Do so.
It's a good idea.
Great idea. Reach out anytime.
Yeah, I mean, and just going back to that last call, like this fear about going to see somebody because you're afraid of an injection or medicine, like step one is get the diagnosis. And I don't know how important that is to stress. And don't be your own diagnostician. Don't use Google. Don't talk to your friend who doesn't know anything and get their opinion on it. Like, go see a professional about it. No one can force you into a treatment intervention. Right? It's not like you're going to see a surgeon and they're going to say, okay, well, you're doing surgery and you don't have a choice. We're going in right now. Like, you don't have to do that. You can get a second opinion. You can then do your own research. But at the very least, go get an opinion on the diagnosis, on what it is. And even if you want a second thought on that, what that potential diagnosis may be, that's fine. But stop thinking that the initial interaction is just about the treatment. It's about understanding what it is.
You know, it's funny though, and we've talked about this before going into surgery, or for yourself for your knee problem. Now it's the prehab and having yourself in good shape before you go in.
Yeah, 100%. Yeah,
I had a friend of mine from my gym. He's a cyclist, avid cyclist.
Glad to hear you have friends.
I got one or two that I don't have to pay for. He texts me on Wednesday night and he says, "Hey John, he calls a little bit of bad news on my part over here.
Yeah,
Wednesday, riding my bike around Kipling in Eglinton." Gets nailed by a car.
Ooh.
2 fractures in C4, hemorrhaging on the brain, 2 broken fingers, a lot of scrapes and bruises at Sunnybrook in trauma. But he's only going to be there a couple more days. And he's going to be, right? So he's okay. And then he's going to be out probably with a neck brace for 4 to 6 weeks.
Wow.
The speed of that lends me to believe that this guy's, he's 50, 55 or 56, I think Greg is, but he's in such great shape that they probably said, okay, you know what, you're going to be okay to go home in 2 or 3 days and mend.
Yeah, definitely if you're healthier overall and you sustain something like that, your outcomes later are always better, for sure. I mean, that's a horrible accident, right? Like hemorrhaging, C4 fracture. Like he's very lucky to be able to be texting you and tell you that he's going to be walking out of this hospital. Like that is amazing. So, I mean, that's great to hear, but I see where you're going with it. Absolutely. If you're the better shape that you're in and better shape doesn't always just mean like, that you have a six-pack. It's just about being healthy. But if you're healthy, then anything that you sustain, you're going to do likely better with it. It's just the reality.
Get to John here. Hey, John, thanks for hanging on. Good morning.
Good morning to you. How are you all doing this morning?
Good, sir. Excellent. How are you?
I'm so far so good. Last time I checked, anyway.
That's right. What do you? What's your question?
My question is, this has started about 3 months ago. The piriformis muscle.
Yep.
Was touching or inflamed, I guess, and touching the sciatic nerve. And I've been doing different things. I've currently just finishing up with the physiotherapist.
Okay.
And some other people have told me that maybe I should try acupuncture.
Yep.
I was wondering whether your guest there has any suggestions on whether acupuncture is probably a good thing for me to try.
Yeah. So assuming that it is a piriformis syndrome, right, because I have to make that assumption. I get that you're telling me. But so when it's a muscular issue putting pressure on a nerve, then there's a lot of different ways that could potentially release that muscle, like therapy, exercise, and also acupuncture. So it sounds like it would be a worthwhile thing to try. I don't know for sure in terms of, again, I'm taking your word on that it is a true piriformis syndrome, but a true muscular issue could possibly respond to acupuncture as well. So I don't think that it's that is something that's totally, left field or anything like that. It sounds like it could be a viable option.
I've been trying cold packs and exercises, and then
cold won't do very much if it's a true muscular issue. Like, again, think of a steak, right? Like if you put it in the fridge, it tightens up and things like that. Muscular issues will tend to respond better to heat and loosening things up.
Well, the last suggestion was given was a hot pack, exercise, then the cold pack.
Yeah, again, the cold pack to me on a muscle, especially there's no great answers around ice and heat. But from my perspective, I really like ice for, number one, smaller areas of the body like hands, ankles, wrists, like things that actually have contact. And when there's true inflammation, in general, the low level aches tend to respond better to heat because, again, it's more of a muscular issue. And inflammation, like I really like ice for controlling inflammation.
Okay, they told me in the first part that hot would inflame the muscle more, and I shouldn't use it, and that's why they told me about using the cold pack. But anyway,
everyone's got their opinions,
right?
After this length of time, I thought I thought of getting a little tired of it, sort of. So,
well,
I'm an active
here's the other thing. A lot of times when you're treating something, like if you're treating a certain diagnosis and that diagnosis is not getting better, then maybe the diagnosis is wrong, right? So that's the other option. That's why I'm saying, assuming it's a true piriformis syndrome, it might not be. Maybe it's worthwhile to get a second opinion on even what the issue might be.
John, appreciate the call. Heather, Sue, see you guys there as well. Hang on, we'll get to you after the break. Still plenty of time for you as well. Bring them on. You got concerns, 416-870-6400, star 640 on sale. Dr. Payne Show, Global News Radio. Dr. Payne Show, 416-870-6400, star 640 on sale. Heather, thank you so much for hanging on. Good morning.
Good morning.
What's up with you?
Well, it's really my mom, and she has swollen, like, Achilles tendons and a swollen knee. So, of course, and she has a bit of rheumatoid arthritis. So she goes back to the rheumatologist for, like, almost a year now. And all the rheumatologists keep saying it's inflammation. It's inflammation. Mm-hmm. I'm like, Mom, yes, inflammation, arthritis, which means inflammation. And I'm a dancer,
it means inflammation and deterioration of the joint, but okay.
Right.
Yeah.
And I'm like, Mom, and all they want to do is put her on medication, like methotrexate. And so last week I was with her, and I said, and she had an MRI on the knee, and of course there's swelling. Of course there's no torn meniscus. It's just a lot of swelling, a lot of fluid, what I'm trying to say is all these doctors want to do is just put her on methotrexate. Like they just want to say, we'll take down the inflammation. And I'm a dancer, and I know I've had knee injuries, ankle injuries. I said, Mom, I want to know how you got that. I want to get to the bottom of it. So I made her an appointment with my orthopedic surgeon after he saw the MRI. He said, sure, I'll see her. I made her an appointment with a foot specialist in the city. They said, did you do a Doppler test? I said, no, they haven't. Well, if you have swollen ankles, we want a Doppler test. So I said, Mom, you go to your doctor, your family doctor, and demand a Doppler test. What I'm trying to say is I'm doing all this work. Am I on the right path so that I can get to the bottom of why there's inflammation, not just say, take methotrexate?
Yeah, so this is where, and I'm going to be brutally honest with you, this is where a little knowledge is sometimes a dangerous thing. So one of the big important things here is that she has rheumatoid arthritis, which is an autoimmune disease which causes your body's immune system to attack its own joints. In that attack, it causes inflammation and breakdown of that joint. That is why she has inflammation. The reason why they're recommending things like methotrexate is because those are the drugs and the pharmaceutical products that are used to stop the autoimmune component, right? There's like when it comes to autoimmune diseases, this is very different. This is where medications and those things are very, very important. All the therapy in the world isn't going to suppress her immune system, right? And that is the component that's very important. And so when you say like all they want to do is blah blah blah, well, it's not all they want to do. It's the best option for that, right? So you trying to figure out, like, now if you want to figure out why she has an autoimmune disease, good luck. You'll never understand that because we don't understand it in healthcare, why some people get certain autoimmune diseases and other people don't. A lot of it has to do with genetics. A lot of it has to do with different things that happen in your life, but you'll never understand that. What's important, and I often tell people this, is accept it. You have it. It is what it is. If they've confirmed you have rheumatoid arthritis, then what you need to know is that those joints are going to inflame and those joints are going to deteriorate. And that process doesn't stop. However, those medications, and I've seen tons of people who were recommended to take these immunosuppressants and opted not to. And when your joints deteriorate enough, then they'll start to shift, they'll change shape. And those people now have deformities because they thought that, I always say, you don't know what the future possibilities are. And us, the professionals, we've seen this stuff. We've seen it at the beginning, we've seen it at the middle, and we've seen it at the end stage when people don't do the things that are recommending. Now, I think the bigger problem here is no one's taken the time to explain this to you guys. And that's a systemic problem within the whole industry, which is why I do what I do. But in the little bit that I'm explaining to you, I don't think that they're wrong in their approach. I just don't think they've made it clear to you why that's the right approach.
I understand fully now. Thank you
no
so
problem.
much.
No problem.
Thank you. Thank you. Bye-bye.
Appreciate it. We'll move on to Sue. Sue, thanks for hanging on. Good morning.
Good morning. I have a question. My husband has plantar fasciitis, and he does the whole golf ball under his foot, and he has the insoles in his feet, the
orthotics.
Orthotics.
Yeah.
However, since December, it's been a constant. Every day it's been there, and he wakes up in the morning excruciating pain, and it's there all day. Now he does for a career. He's on his legs all day.
Yeah.
But I don't know if there's anything else besides the orthotics and the golf ball that can help in assisting him.
Yeah. So orthotics, is your husband flat-footed?
Yes.
Okay. Yeah. So, I mean, the orthotics, I guess they're trying to hold a bit of an arch in there to keep the arch there. I mean, I think it requires therapy, in all honesty, when you have these types of things. The other thing is, if there's an area of injury to the body, if I hurt my elbow, for example, I would likely stop bending repeatedly stop bending my elbow, which would allow it to heal. The problem with foot issues and plantar fasciitis is you don't really stop walking, and it's compounded further. If your husband walks a lot for a living, then it's never really given a chance to rest and heal properly. Now, there are other things like shockwave therapy that could be tried. It's hard to say. I'd be very happy to assess him and see what other options exist. It's not like there's nothing that can be done. It's just a matter of trying to come up with the right plan. And sometimes that plan might involve building in periods of rest for those things. And that's an important thing when you're dealing with a repetitive injury like plantar fasciitis, because that's what it is. You're constantly, walking, doing things. It very rarely has a chance to heal properly.
Okay. Now, if I wanted him to come see you, whereabouts are you located? Can I find that information on the website?
Website? I do my assessments in Etobicoke. I see you're calling from Toronto, so at Etobicoke General Hospital, so Highway 27 in Finch area. But yeah, give me a call, 1-855-55-Dr. Lou, or send me an email at info@paincarecanada.com. Include your phone number, and somebody from my office will give you a call back to book that assessment.
Okay, thank you so
awesome.
much, Dr. Lou.
No problem.
Thanks, Sue. Appreciate that. Again, 1-855-55-Dr. Lou, DRLOU, info@paincarecanada.com. Your phone call, still lots of time here. It's only 11:39. We'll carry on with the show, 416-870-6400, star 640 on sale to Dr. Payne Show till 12 o'clock, Global News Radio. It is 11:40, Dr. Payne Show. You still got some time. 3 years we've been doing this show?
Yeah.
Come on.
Yeah, I'm trying to think back now. Yeah, I think I'm not sure.
You've helped a lot of people.
I guess so. I hope so.
Yeah.
Yeah, we had some very nice Facebook. Like, some people said some very nice things about me, even about the staff that they seen for treatment. And those testimonials are available. Like, type in Pinpoint Health right now. All the clinics are associated with that. So type it in. Go read the Google reviews for yourself. Right, like their testimonials. There's between all of the clinics, there's got to be probably over 200. Right, so. Definitely that'll give you a sense of things. But I'm thinking back to that call we just had with the lady about the mother with rheumatoid arthritis, and I think there's a big problem, and I think one of the things that people really like most about interacting with me is how much I'll explain something, because a lot of the times I don't have any more, special tests than anybody else does. Like, it's not like, I'm that much smarter than any other doctor out there. I'm really not. But I think I really enjoy explaining to people what's wrong. And I don't just do it on a chart. Like, anyone that's come to see me, I draw a lot of stuff for people because I break it down. Nice. Like, it's very intimidating to show somebody a skeleton on, and it's like, whoa. And, you're trying to pinpoint it on this knee. Like, I'll draw the knee joint. I'll explain how arthritis happens. And, I'll go through these things. And I think that's really what I'm doing different, is really making sure that people understand. I want people to, the way that phone call ended, to say, I understand. Right? Like, now I get why my train of thought may have been wrong. Right? And that happens a lot. And I think
that's a form of treatment, really.
100%. Yeah, 100%. But I would say that, if you said, what is it that you're doing different than anybody else? I would say that's the sort of my thing that makes me different from the average doctors. I really spend a lot of time making sure that people understand what's going on. Yep. And a lot of times people will come in and it's like, I had another person, an older couple. The husband had very severe knee arthritis, and was just told, oh, you have arthritis and you need a knee replacement, but they wanted a second opinion. I looked at it. I was like, yeah, this is bad. Like the bone was starting to deform. And I basically agreed. I said, yeah, you're at the point of a knee replacement. But I didn't just stop there. I said, here, let me show you what happens, why the bone has changed. And finally, they were like, okay, this makes perfect sense. We're going to go book a knee replacement. I didn't offer a new solution. I just gave them the reassurance that they understood so they can make their decision.
416-870-6400, star 640 on your cell is the way to go. Jack, how are you, pal?
Oh, hello, John.
Hi.
Dr. Lewis.
Hey.
So what I wanted to call about is I just heard the opinion, and the question regarding the woman's mother who was on methotrexate.
Yep.
Yeah.
And I just my mother was also put on methotrexate.
Mm-hmm.
And she developed rheumatoid arthritis probably in her sort of mid-70s.
Yeah.
And at that point, before that, she was still golfing sort of probably into early to mid-70s.
Right.
And it just sort of ravaged her.
Mm-hmm.
And really her diet had drastically changed at that point in her life.
Yeah.
She was basically a teetotaler. She started having wine and cheeses, which she stopped doing, and started doing, and I really think there was a real strong component to her diet, and I just thought that the woman's mother should consider going on an elimination diet to see what things her body is fighting.
Yeah, for sure.
My mother was put on methotrexate, and that's what took her life was methotrexate. When she finally died, she had a fracture in her. She stumbled getting out of bed. She had a fine crack in her rib, and basically what happened is she couldn't work anymore. Her lungs wouldn't work anymore because they went hard, and it was called, the nurse referred to it as methotrexate lung.
Right.
And so I just think it's a real, it's a strong medication that can really, wreak havoc on your body. And I just think if you go with, trying to look at the elimination and
first,
your body's, because my daughter has a celiac. We look at again elimination diet and going back from there to get her body functioning right, so it's not fighting off things. So I just wanted to
I agree and I disagree to some extent. Again, I think every case has to be looked at an individual basis, right? So just because it worked for something bad happened with your mother, and I get it. I get what you're saying, but that doesn't mean that methotrexate should never be the answer for anybody. I definitely agree with the elimination diet. Obviously, if I saw that person in my office, I would tell her that there's more things. It's a compounded effect, right? There's a lot of things there. Like we're talking, you mentioned your mother was in her late 70s. Like that also moves towards the end of life anyways, right? Like versus someone who might be diagnosed with some type of autoimmune disease in their 20s. I know someone who had psoriatic arthritis and needed to take it because if she didn't, she probably would have got to a certain age where she wouldn't be able to move. And now she's taken it. She's had, kids. She's doing well. So this is where the dangerous component of this, and I often say this, where like people will say that like, oh, I talked to someone and they took this or they did this and it worked horribly for them, or even on the other side where they did this and did this and it worked amazingly for them. Healthcare is individualized. We have a ton of tools at our disposal, a ton of different interventions. It's really about looking at an individual and saying, okay, what is the best combination of those things? And so although I appreciate what you're saying, and that's why I say I agree and I disagree. I agree in the sense that for your mom's individual case, you're right. For the general population and for everyone to take that one case study and say that should apply to everybody, that's the component that's wrong. We can't base healthcare on just one case. We have to. That's why in research we look at systematic reviews where we look at what is the effect in general, right? It's the same as when you have this conversation around vaccinations, right? And where now there's this anti-vaxxer thing because there are individual cases, which, maybe there are. But when we look at the research on a grand scale, the benefit greatly outweighs the negatives. And this is the component where it has to be individualized. So I thank you for your call. And again, I agree on a lot of things that you said, but I also disagree with some of those things.
Okay, then.
Oh, Yeah.
Done. It's true. I mean, it's so individualized.
100%.
What might work for you might kill me.
100%. Right? It's so, and this is the scary part, right? Where people listen to this sort of hearsay, like where they're listening to just somebody's, aunt that did this and blah, blah, blah. And it's like,
and they'll tell someone, it just ends up being herd mentality.
It drives me crazy. It's like, that's not the right way to do it. Yeah. The right way to do it is find somebody you trust to lead your healthcare. Yeah. If you can find that, then anybody that's good will consider all of the options that exist. I definitely give all of these options. Another component of autoimmune things is the cognitive behavior therapy. Right? Like a lot of people that you talk to that have these things are incredibly stressed. And like one of there's a thing called the 2-hit hypothesis. When you look at genetic predisposition, the 2-hit hypothesis is, number one, you have to have the genetic predisposition for something. And number two, you have to have something that triggers the genetic expression, which that could be stress. Stress could be physical. It could be mental. It could be social. It could be a lot of different things, right? It's like, why do some people that smoke now, and this is not me endorsing smoking because I actually think it's the worst thing that you can do for your health, but there are cases out there of people who have smoked their whole life and never have any lung problems.
And they're still smoking.
And they never have any lung problems. Why does that exist? I don't know. And again, I'm not endorsing that, but this is what I'm talking about. We wouldn't take that one case study and say, well, then, everybody should just smoke because, a couple of people have survived. So
people
it's
win
totally
lotteries
fine.
too, right?
Yeah, that's not the way it works. And I get people, you focus in on your own realities in your own world, but in healthcare, it's bigger than that. We got to look at the grand scale and in general, what is the right approach, and then taking that general knowledge and applying it to an individual in an individualized way. That's what we do at Pinpoint Health.
416-870-6400, star 640 on cell. You still got a few minutes to call in, ask your questions, get the ball rolling here with Dr. Payne. Dr. Payne Show on Global News Radio. 11:51, a few minutes to go here, and a reminder, it's already up on social and Living Large, Pinpoint Health. You want to check it out on Facebook or Instagram as well. Some good stuff in there. You always put videos up on Tuesdays, a lot of explanation, a lot of good stuff.
Oh. Thanks, Jody.
And you got to learn how to turn on your own mic, you dolt.
I'm spoiled. I've had it done
for me. You're totally spoiled.
It's all about, if you spoil somebody, it's not just the person's fault who's being spoiled. It's the spoilee as well because I'm not in the habit of using my own mic. Here we go. Let's put this over here.
John was talking so much, I didn't know when he was going to stop.
Jody just got blamed.
I didn't know when he was
I'm not blaming Jody. I actually enjoy Jody a lot. You might be the bigger problem here, John.
Hi, Carol. Good morning.
Good morning.
How are you?
This is Faith. I've been meaning to call you for a while.
Oh, great.
I woke up to you this morning after a really rough night.
So what's
I don't mean to laugh at the rough night. I'm laughing at what John said.
Yeah.
He's just the natural comedian over here.
Gotcha. PMR.
PMR, okay. Polymyalgia rheumatica, is that what you're referring? Yeah, okay.
Yes. I've been diagnosed.
Yep.
Last October.
Yep.
But not an awful lot has happened, and I don't really have a much better explanation than, it's the front of your body, it's an immune disease, it matters, I'm 78.
Mm-hmm.
I still don't know an awful lot about it, and it hit me out of the blue, and if you say those initials to a lot of people, they say, what?
Yeah. Well, it's not. So it's an autoimmune disease as well.
Yes.
So if we break down the word, poly meaning multiple, myalgia meaning muscle pain, rheumatica. So, rheumatic muscle pain in different areas. Oftentimes, people have this in the upper back, the shoulder areas, and then in the lower back buttock region. And again, this is something, this is where when we're looking at autoimmune diseases, it's about, controlling it with the biochemical interventions such as the medications, the proper combination of exercises, proper eating, like the previous gentleman was saying about elimination diets, and making sure that you're doing other things like they're limiting alcohol, no smoking of cigarettes, these types of things. Are those if you tell me a little bit about yourself, I can sort of tell you whether you're on the right track or the wrong track, I guess.
I don't smoke.
Okay, good.
I don't drink.
Good.
I might have the occasional glass of white wine.
Yeah, that's okay. Yeah.
I have, from the age of, maybe even 18 on, had osteoarthritis.
Right, okay.
But never went the next step. And with very glad that I didn't have rheumatoid arthritis always. But
osteoarthritis doesn't always lead to rheumatoid arthritis, right?
I understand that.
Yeah.
In this case, that word's getting tossed around a bit.
What's that?
Rheumatoid arthritis.
Okay. But I thought they diagnosed you with polymyalgia rheumatica.
Yes.
Okay.
But the rheumatoid, the doctor is forever going back to one joint or one thing or another and refeeling it. And
but here's the important thing about this, and this is where sometimes getting hooked on what at the end of the day, what's important here is it seems like it's autoimmune. Right. So if you treat it like an autoimmune disease, which again is whether it's rheumatoid arthritis or polymyalgia rheumatica or some other autoimmune disease, what's important here is that you likely have widespread pain in your body due to inflammation, due to your immune system attacking those joints. So again, if you treat it from the aspect of the biochemical interventions, the exercise, the proper eating, the mental health component around that is very important. If there's high stress, anxiety, or depression, then I think you can manage it. Will you cure it? No. But that's not what this is about. It's about managing this so that you can live day to day.
I take codeine Contin.
Okay.
For pain.
Yeah.
That name just escaped me. There's talk of starting me on the drug for malaria.
Okay.
I am not depressed. I'm upset because I had a life to live till this hit me this hard.
Well, that's stress, though, right? Like that, it doesn't need to be stress. Doesn't just need to be depression or anxiety. Your anger is also a stress, right? So, I mean, So, Carol, what are you looking for? Sort of for me to give you an answer?
No.
Yeah. Okay.
A better explanation.
Okay. Yeah.
Of what is.
Yeah. Well, that's what polymyalgia rheumatica is. It's muscle pain in multiple areas. Again, it's often diagnosed because now I'd have to give you a lesson on rheumatoid disease or on autoimmune diseases, but when you look at what we call seronegative spondyloarthropathies, rheumatoid arthritis has a very specific biochemical marker. A lot of the other ones don't. Oftentimes with polymyalgia rheumatica, it has to do with high ESR levels, which is an inflammatory marker, which is, I forget what it stands for, but not that matters. That's probably the way it was diagnosed. Other things were excluded. Your ESR was very high. You have widespread pain throughout different areas of the body. And so they're telling you that you have polymyalgia rheumatica.
Yes.
Yeah.
That's except I thought I had the flu. Spent the whole month thinking I had the flu.
Wow. Right.
Ended up in hospital.
Mm-hmm.
That's where it was diagnosed.
Yeah.
But I just, I'm sorry. I called you too soon after waking up. Now I haven't got myself together here.
That's okay.
I also, in reading and the things I've tried to find out, it can go away.
Potentially, yeah.
I'm on prednisone.
Yeah, a lot of sometimes autoimmune diseases can just sort of, disappear. But I don't, again, this is about proper management of it. Come see me if you can, Carol. I think we can go through a lot of things. But yeah, the explanation. I mean, the last part of the show highlights the explanation component for sure. How important it is.
Carol, reach out 1-855-55 Dr. Lou. Again, 1-855-55 Dr. Lou, DRLOU. info@paincarecanada.com. Till next time, Dr. Payne Show. Appreciate all your calls. We'll do it again next weekend right here on Global News Radio.